in this last one, she got the giant like
the
coronavirus
cycle.
one,
Right.
and we got hardly nothing.
That was the one where Reed Timmer with the Weather Channel, the Storm Chaser, was here chasing down that tornado live. I was watching him live on Twitter. He's like, "Hey, so city right now."
And my mother-in-law, they live by the outdoor campus.
Okay,
On
and that's kind of closer to
the interstate and stuff.
Yeah. Too, and they get a lot there. We're kind of lucky. We're just kind of we're up Sheridan Lake Road, kind of near Spring Canyon, like just to the eastern side over the canyon from like Highway 16, the other side. Okay. So I don't know, the weather always seems to like kind of change. I don't know if it's the canyon that kind of changes the hazard a little bit. We usually don't get. My mom and sister were camping at Sheridan Lake that day for my nephew's birthday, and my husband and I were looking at the radar. We're like, I think it's gonna fizzle out. I think it's, but there's no cell service either, so it's not like they could even watch. Yeah. Well, you can kind of look in the sky and see if it's good. Yeah, I went up the next day and they said this, they just had a little rain. Yeah.
Hello, Cassie, and hello, oh man, I've got my list here, Dr. Heidi. We will begin doing some audio checks in a bit. We're waiting for Brant to get on to check delay and all of that jazz. So we will be with you guys momentarily once we get some other stuff handled.
Okay, hello. I just need to fix something real quick.
All right.
Okay. Just give me a quick minute here. I'm just running around. Need to find an extension cord. Perfect. Right here. This can go here. Okay. This one towards the end. Why is it doing this? That's not good. That's what I want, right? Right there. Okay. I think that'll work. I think. Perfect.
This might be a little better. Mhm. Maybe a little worse. Maybe down one. Good.
Hello,
Hello.
how's it going?
Oh, it's Friday.
Yay! But it's hot. Why are you making it hot, Grant?
Well, it's July, and I think we should have 100 degrees just to remember what it feels like. Just in case you
Okay.
forgot. Let's see. Try things down.
Hello, everyone. Thank you for joining us. This is Ethan Anderson with News Center One. We are going to get Brant to do a mic check here in a little bit once he's got his ducks in a row. Then we'll do individual mic checks with each of our panelists today once everybody's up and running. Then we will have a super fun, quiet game at 10:57. Where everyone just gets to be quiet until Brant starts talking, and it can be a couple of minutes because we have a huge delay because of the way we have to do these. So that'll be a super awkward few minutes, but I'll let you guys know when that hits. And from there, just kind of looking at everybody's cameras, I think we're okay so far, but we will double check cameras and audio here in a little bit.
Don't mind me, I'm just making sure I have the titles written down. I'm still writing Cassie's down. Administrator for the Office of Disease Prevention Services for the South Dakota Department of Health.
It's a long one, yes. No, it's a mouthful. Every time I have to say it, I pretty much stumble. So
The more words, the more important. That's the way it is.
oh, I don't know about that.
Perfect. It's like the guy with all the keys, person holding all the keys. That means lots of doors, important person.
Yep.
Okay, Brant, we are going to do a delay check here in a minute. So if I can
Okay.
have everyone else lay out, just mute your audio, or I can mute it on my side as well. We're going to do a delay check here in just a second. So thank you all for your patience.
And I'm saying words. I'm saying the most important words because this is a mic check and everyone wants to hear my voice. So I'm going to say words right now just to make sure that my voice works, and it does. This is our official mic check. You have to make it interesting. Okay. This is the second mic check because the first one obviously wasn't enough. We need to do a second one because people want to hear the sound of my voice. That is your official mic check. Perfect, thank you.
Okay, so now that we've got Brant's voice all squared away, I'll have each of you unmute yourselves. I'll just go down the line and have you give me a quick blurb, and we'll move through it. Let's start with Dr. Heidi, please.
Oh, that works.
Hello, this is Heidi.
Perfect. Jamie.
Hello.
Hi, Jamie. Cassie.
Hi.
Perfect. Can I get a couple more words out of Cassie, just to make sure your level's good?
Yep, no problem. This is Cassie.
Perfect. Tim,
Greetings.
couple more words. Just
Couple more words.
Oh, wonderful. Thank you. Excellent. And Ricky. I think that's who I have on my screen. Is that right?
Good morning.
Wonderful. Say, Ricky, I've got a little concern with your picture. I'm seeing something at the very top. What we got going on? Just kind of, it's cutting off your forehead a little bit.
Well, I have something hanging down from mine. Is that better?
There, that is.
There you go.
Thank you. Excellent. Okay, I think everyone's audio and video is good. Give everyone another quick rundown. So at roughly 10:57, we'll go silent, which will be the longest couple of minutes of everybody's lives while we play the quiet game and wait for Brant to start talking. Additionally, at the end of this stream, Brant will kind of do an outro, and then we'll need to be quiet for about 30 seconds after that to allow everything to catch up to itself. And then we'll give an all clear signal. Other notes, we use the Zoom group chat to communicate with each other during the stream. So if you could have that pulled up on whatever device or on your phone on the side or whatever, to check that, preferably just pull it up on your desktop. If you have something that you feel like you can add to in a certain question or whatnot, you can just put a message in there and Brant will keep an eye on that throughout. We will also message people if there's something.
We'll be in the meeting in about 4 minutes, but we're okay right now.
I think there's
Nobody's
any
at
other
the house.
notes.
My wife works overnight.
I don't think so. Thank you everyone for joining. These have been a lot of fun. Jamie's been on a bunch of them. They're always really
They start
informative.
going off like
We
somebody.
will have audience questions throughout the stream as well that Brant will be talking through,
Get out there, there's nobody
with you
out.
guys and kind of throwing them at the appropriate parties. So if anyone has any questions for the next few minutes, just let me know. Thank you.
And thank you guys so much for jumping in to do this. Oh no. Oh, cat. All right, I keep the cat off. Thank you for jumping in to do this. We really appreciate it. These have been so good, very informational for the public, and I have a feeling this is going to be one of our most popular ones out of all of them. So thanks for joining.
Yeah, so this will be a basically bouncing around. We'll be taking questions from Facebook in the comments section. from folks tuning in and whatnot. So they will be asking these questions live while we're having the discussion. And what I'm going to do is I'm going to try and get everyone to have their turn, or if there's something that you guys want to say or like, well, that was a really good question and I think I can answer that better, I want to talk about it too. You can either just send a message or send a little message and I'll make sure to bounce it to your section, or it's like, oh, I'd like to add so-and-so to, to what Cassie just said. It's like, okay, then we'll, go to that next person. So yeah, these have been, as Jamie said, these have been really good. And we're going to continue that tradition of excellence today. That'll be awesome. And I'm going to go put on a tie. I feel like we don't have a tie on. I can't do this without a tie.
Yeah, and like Ethan said, the group chat's a really great feature. So if questions come in, if Brant sends a question to Tim, for example, but you're sitting there like, you know what, I want to jump in on that too. Just type that into the chat box and then Brant will see that, and then he'll immediately kind of, after Tim's answer, then he'd turn it over to you. So it works really well, really interactive.
Just put the thing on there. Okay.
Oh, I think I mentioned this to everybody. They'll have like your contact info that they'll put on their website too. So if there's follow-up questions, people will be able to reach out to you as well. So, and then we'll get the recording of this and I'll send it to you guys in case you want to share it with any of your network after the fact.
For sure, for sure. I think we're getting close to our code silence, the silent hour.
Yes, Brant is correct. We are close to the silent time. Just a reminder for everyone, if you're going to be muted during various points in the stream, that's fine. Just make sure that when the teacher, Brant Beckman, calls on you, that you unmute your microphone. Zoom will then automatically pick that up and switch the camera feed to you. So we are going to go silent now so that my director doesn't get super mad at me.
noise. Making noise, making noise. All right. Happy Friday, everyone. We are now making things happen on this Friday, another United Way panel discussion. And this week we're talking about a pretty important subject, as all the weeks have been, but this week, health questions. There's been a lot of them over the last 6 months, and we're going to try and answer a lot of them today. We have a wonderful panel that has been put together, and I wanted everyone to introduce themselves and just a quick 2-sentence summary of what you do and what office you work for. Cassie, we'll start with you.
Well, hi, good morning. My name is Cassie Deppenbaugh. I am the administrator of our Office of Disease Prevention Services for the South Dakota Department of Health. And my office is responsible for overseeing contact tracing and case investigations.
Awesome. Casey, thank you. Or Cassie. Cassie, thank you.
No problem.
Dr. Heidi Strauss from right here at Monument Health.
Hi, thank you for having me. Hope everyone is well. I am an internal medicine physician at Monument Health, and I'm our medical director for quality and safety for Monument Health.
Awesome. Thank you so much. And we have Tim Trithart.
Hi, good morning. I am the CEO for the Community Health Center of the Black Hills, where we provide kind of comprehensive primary medical care, mental health care, and dental care to everyone.
Awesome, Tim. Thank you. And
Thank you.
Miss Ricky Shad.
Good morning, everyone. My name is Ricky Shad. I work as the Director of Nursing for the Oyate Health Center here in Rapid City. However, under COVID operations, I am detailed as the Deputy Health Administrator. Our organization is responsible for the oversight of the healthcare of the Native American population within our entire area. Thank you.
Ricky, thank you so much. Last but not least, looking at Miss Jamie.
Good morning. This is Jamie with United Way. Happy to be a part of this work. As you know, United Way, we are here for our community, fighting for the health, education, and financial stability of everyone in the Black Hills. And with COVID, we've been doing a ton of work around collaborating with various partners, as well as providing grant funding to nonprofits, libraries, and school districts here in the Black Hills to help them work with their clients during COVID.
Jamie, thank you so much. So obviously, wonderful panel put together here, and we're going to have some hard-hitting questions right from the get-go. We're having people still join up right now, but while people are joining, I wanted to open things up with Cassie. I wanted to ask you, what are some of the common questions, just in case someone's getting ready to ask a question right now, what is probably one of the most common questions you've gotten over the last couple of weeks that you'd probably want to get out of the way right now if anyone's wondering?
So there's been a lot of questions about whether or not someone would be considered a close contact. That's something that we get fairly regularly. And the definition of a close contact is someone that's been within 6 foot of a positive person for 15 minutes or longer. So that's one of the more common questions. I did want to point out too that our department has changed some of our focus to focus on some more broad areas within our department. So we have teams that are now focused on businesses, on childcare, schools, universities, tribes, community support. So we have a lot of different resources that we've been developing as well. And many people I know are probably familiar with our covid.sd.gov website, but there are a lot of resources on that website for people throughout the state. And I would certainly recommend people utilize those resources and go out to the website and see the different things that are available.
Cassie, that's kind of fascinating what you just said. So you actually are now kind of putting an attack plan together for depending on where you work, what kind of workplace you're looking at, whether you're at school, whether you are looking at, working with childcare. So is that kind of what I'm hearing, is that those things are kind of being compartmentalized at this point?
So what we're recognizing right now is that there are some other areas that are needing highlight within the response to COVID. So obviously you're familiar with some of the discussion around schools. So we have a team that is focusing on assisting and providing resources to schools so we can plan ahead. And similar to vaccinations, for instance, we know that those are still important, and we want to make sure that we're still prioritizing some of those needs in addition to COVID response. So we're still continuing everything that we're doing. We've just restructured and looked a little bit more at a overall response to COVID. Initially we had that surge and we've been able to prepare and respond. And now we have some other areas that we really just want to provide resources for and create some accessibility for the public.
Cassie, thank you. That's an important piece to all that, is that this is developing, we're developing different methods as we go along with this that better suit the diverse situations we got going on. Dr. Heidi, I wanted to switch things to you real quick and see if there's any questions that you've encountered a lot from folks that could be readily answered, or something that you're currently working on.
Yeah, that's a great question. Obviously, with the time with this pandemic, there have been a lot of questions around COVID-19 and whether patients have had exposures or if they're having symptoms. We see a lot more clinical questions around that question. One of our great opportunities for patients is we have a free nurse triage line through Monument Health, and anyone within our community who has questions or needs to talk to a medical provider about their symptoms or concerns can call that triage line, and the number is 755-1350.
Okay, that's a great resource. So in that case, let's say, I live here in Rapid City and I develop a sore throat. I'm not really sure. Maybe I have a fever. I'm not quite sure. I don't want to go straight to the ER or anything like that. So would that be a good number to call then? And if I'm having those kind of questions, or is there a specific route you want us to go?
Yeah, certainly. So that's the primary route if you're concerned particularly about coronavirus symptoms or COVID-19 symptoms. But the triage line can also help you with any other questions you have about other symptoms too, and certainly link you up with the appropriate care team or provider to get you that great and fast access to care.
Dr. Heidi, thank you so much. Tim, I wanted to throw things over to you. What are some of the questions that the community have been asking, or maybe some of the issues that you've seen out there that you're currently trying to get resolved?
Well, I think that, one of the things that, we're obviously getting a lot of the same sort of questions when it comes to the COVID-19 stuff, but we also are seeing that, there's a lot of other issues healthcare wise that we deal with here in terms of concerns in terms of, can I come into the clinic to get my kid immunized? And what risk am I going to be putting my kid at if they're going to be subjected to a whole bunch of people that may have COVID? And so I think part of what we're trying to do is also to convey in terms of the steps that we've taken to ensure the safety of all of our other patients, that even if you don't have COVID, you still need to come in and get your diabetes checked and get your hypertension taken care of and get your teeth cleaned, those sort of things. And so there's a lot of the ongoing care sort of things that a lot of people have been kind of putting aside, I think, as we've gone through this pandemic. And I think it's important that people feel comfortable coming back to healthcare clinics so that they can get their normal routine care taken care of as well.
Yeah, Tim, that's great that you actually touched on that a little bit, because we have people right now that are asking questions in the Facebook comment section. And one of them was right along those lines. By the way, if you have questions, you can ask the question in our comment section on the Facebook Live, and we'll ask these questions live right now. Or even if it's after this session is done, we'll go back, take a look at those, and try and point you in the right direction for that. But yeah, Tim, we had Lauren who's asking, should I still be going to my regularly scheduled doctor visits? Should that be changing? And what I'm hearing from you is you probably should.
Yeah, we've kind of ramped things up, and basically what we're doing is doing a little triaging before ahead of time to see exactly if you're symptomatic, and if that's the case, then we want to identify that and route you the proper way so that we've got areas of our clinic that are kind of reserved for those people that have symptoms. And so, we've got all the proper PPE with that particular staff. And certainly what we're doing is every single patient who comes through our doors, that we're masking them up and taking their temperature and making sure that, where they're at. I get my temperature taken every morning when I walk through the clinic. And so today I think I was nice and healthy. The 96.3 I think is where I was at. So it's important that people continue to follow through with those appointments and obviously follow whatever the clinic is, what their guidelines are for coming back in.
And Dr. Heidi, you had something to add to that with Monument Health.
Yeah, I would piggyback on what Tim said. The continued health of our community is one of the most important things as well during this. And also with Monument Health, we've been able to open up our clinics to full operation. We also offer some options to in-person visits for patients that may have some concerns or reasons they can't come in, such as telehealth, including telephone and video visits. So those have been really helpful. And we really want our patients, especially those with chronic health issues that need to keep well, to make sure they keep that regular follow-up so they don't get sicker and we can keep them safe.
Perfect. I like that lead in because I want to send things over here to Miss Ricky and kind of talk about some of the things that you've been seeing, maybe some of the questions unique to your organization, and what have you been seeing out there?
Sure. So one of the things that I think one of the most common questions that we get here at the Oyate Health Center is how people can get a test done if they needed it, or if they felt that they needed. Like everybody else in this, in Rapid City, we're doing the very similar things, taking temps, screening people at the front door. Beginning on Sunday, we plan to start moving toward providing a mask, a facial covering for everybody who enters our doors. Regardless of where they're receiving care or services within our organization, we would like to see everybody or provide that opportunity to give everybody a facial covering. So we will be providing them masks. But back to the testing situation, that is probably one of the most common things that we get asked. We do have a curbside testing opportunity for anybody who is a beneficiary or a relative of a beneficiary who may not be a beneficiary of the Federal Indian Health Service System or Oyate Health Center can come up and get a curbside test. We're doing the same similar screening questions. We do ask individuals to get pre-registered prior to coming up. I know since we started that process a couple of weeks ago, we've had up to near 90 tests, curbside testing done every single day. So we're actually getting a lot of tests out there. It seems to be a very effective process for our people. I know one of the barriers that we have encountered with it is that we've had individuals wanting to come up and get tested, but without transportation. So we are looking at different ways to provide that service to our population of people that we serve.
That's a really good point. And I think that's actually a great transition to bring up Jamie here and kind of ask, so let's say I'm trying to figure out where to get a test, or trying to get transportation, or maybe I have both questions about where to get a test, but also I'm low on food supplies. I'm not really sure where to go. There's kind of a hub for all this activity.
Yeah, there is a great network here in the Black Hills consisting of nonprofits, local government, all kinds of entities that are really working hard behind the scenes to collaborate and make sure that resources that are needed for individuals and organizations are out there. And so one of the best places to start is 211. We've tried to use them as that hub so that everybody's getting their information to 211. So it's kind of that one-stop, first stop when you need help, and then they can point you to what resources are available. Yeah, because it's a lot of people are experiencing some different challenges right now due to COVID, and so there's a vast network trying to meet that need And also then if you're having those needs and you're not finding help, I would encourage you to, reach out to me or reach out to any of your partners or groups you normally work with and let them know so that we can recognize that need in our community and we can do something about it too. So, yeah.
Jamie, thank you. That's important, being able to have the one place to get all the other resources that you're looking for. Jamie's like the hub for this activity. Her and I have been working together the last couple of weeks, and it's been wonderful. Dr. Heidi, you had something to add to the previous thought about retesting.
Yeah, certainly for people who have questions about testing or whether I need a test and they're not sure what to do. There's a lot of avenues within our area for testing, but one, if they're not quite sure, they can always call our triage line through Monument Health at 755-1350. And our triage nursing line and experts can help the patient decide by going through their questions about symptoms. If they do need testing, and if they can actually order and set up that test. And those are primarily done right now through our West Side urgent care location off of Jackson Boulevard, and they're all drive-through testing.
Awesome. And Cassie, you also had something to add to that as well, I believe.
So I'd like to just go back to what Jamie was talking about with community resources. And part of our process for case investigations when someone tests positive is to determine if they have the ability to isolate at home. And so in addition to what Jamie was saying is making sure that they have a place where they're able to be secluded from others, where they have a bathroom that they can use. So there are some instances where individuals may not be able to do that at home. So we have worked through some different resources that we have to offer individuals the opportunity to isolate elsewhere. There's also some resources that people are utilizing for food services and other resources that just allow someone to appropriately isolate or quarantine away from others so we can slow the spread of disease.
And Jamie, I'll send things right to you. Looks like you're right on that.
Yeah, so that's a great point, Cassie. One of the things, like, we've partnered with Great Plains Tribal to give some funding so that they're able to help support some of those families who may not be able to go home, so that they can have hotel room vouchers, food and hygienes and those types of supplies delivered to them. So yeah, it's been a great partnership with those types of resources that are available too.
That's really important. Just hearing that. So if you think, well, I don't, it's a luxury to be able to isolate and to be able to quarantine, and it's not so easy for everyone, but there's resources out there to make that easier. If you have questions about that, there are resources available to at least inquire about. And I know there was other folks that had things to add to that. We have so many questions right now in the Facebook comments section. I want to get to, because some of these are pretty good. And actually, Jamie, I'll go back to you, or unless someone else has a good answer to this question. Mr. Victor Andrews wants to know, are there services being provided to promote physical activity during these times? And what may they be? And I guess I'll piggyback on that a little bit, is because I think folks are concerned, is like, well, we want folks to be healthy because that's one of the better ways, to fight if you were to get COVID-19. It's like one of the better ways is to be in good physical shape. And if there are programs to keep people physically healthy, Jamie, do you know of any outlets of that kind? I'm not sure I know of any per se, like any professional organization that's putting that together.
I know Visit Rapid City and some of those types of tourism organizations have been trying to really promote a lot of the wonderful activities. We're all lucky enough to live out here in the Black Hills where there are trails where we can easily maintain that safe distance and get some fresh air. And so, I'd say maybe visit some of those types of sites. They've been trying to do a really good job of promoting that.
Yeah, I think that kind of answers that question, is that there are still physical things to do. And if you're looking for them right here in town, there's you go to Visit Rapid City and they'll have these different areas. It's what the nice thing is, it's kind of easy to social distance in the Black Hills. We got a numberless amount of trails out there, and things will start to be picking up. It is tourist season, whether people are coming or not. there's going to be some folks that are coming up, and just making sure to maintain social distancing while on trails, I think, is one of the best ways that you can get that physical activity while also being responsible. And we have another question. Let's see, where was this? I had it. Oh, this will be for Tim. So what kind of options are available right now as far as setting up virtual visits? Have those been going okay, or are you guys kind of modifying that? What's that look like right now?
Yeah, we certainly ramped a lot of our telehealth sort of stuff up in the last couple of months, and certainly most of our behavioral health stuff, our mental health stuff, counseling, and all that sort of stuff is pretty much 100% now telehealth. And we're just reviewing some satisfaction surveys this morning that shows that the vast majority of people that are doing that actually prefer it to the in-person visit. So go figure. We'll probably continue doing that for a long time to come. So, but we're doing telehealth visits, so if people are concerned about coming in, as much as we can, we'll do a telehealth visit. So, and as long as there's some limitations in terms of the accessibility to technology, sometimes on our patients' side of things. But if they're able to have that technology so that they can do that, and the visit works for that, we'll certainly set that up. We even set it up, and if you'd asked me like 4 months ago, Tim, do you want to look into teledentistry? I would have just laughed at you and said that's the silliest thing I've ever heard. But we've got it set up so that our dentists now can do teledentistry. So go figure.
Wow.
We've moved forward quite a bit on a lot of things here.
Wow, that is a big jump from no way.
Don't ask me how the teledentistry works. I haven't figured that out. But yeah,
No, but it's good to know that that this is expanding. This is something that's been and I see a lot of nodding heads with this. It's like, yeah, this is now becoming kind of a normal thing. And I think with more practice, the doctors are getting practice with this as much as anyone else. The dentists are getting practice with this as much as anyone else. And I'm curious, Ricky, is that kind of the same thing with you guys as far as the telehealth network, or how's that working with you guys as far as setting up appointments and whatnot?
Absolutely. That was something that we initiated right away. We're doing whatever we can to ensure that everybody is, practicing. We're being safe about our appointments. We're being safe about our patient care. We don't want to bring anybody unnecessarily into our facility. A couple of the immediate things that we did, though, we had the luxury of removing our pediatric department, our pediatricians, into a different building, and to provide the pediatric care. And I think that was really helpful for our pediatric population. They really appreciate it, not being near our main facility, where we started seeing, particularly when we started seeing COVID positive patients, right? Everybody started to get a little bit anxious about coming near the hospital and the facility. So that was really helpful for us. Like Tim, I think near 100% of our behavioral health department is all telehealth or telephonic visits. So one of the barriers, obviously, with that is making sure that individuals on the other side have that capability to actually call in or video conference in for a visit with their provider.
So I know, Jamie, you had something to add to that as well, as far as talking about how telehealth has been crucial to here in the Black Hills.
Yeah, just as somebody mentioned, transportation can sometimes be a huge barrier, and especially in Western South Dakota, where it's very rural, everybody's very spread out. Access to healthcare has been a challenge for some. And so the telehealth, the teledentistry, which I didn't even know about, so that's exciting. It is one of the silver linings of all of this, is that it's really fast forward our implementation as a community into these types of ways to access healthcare, which is a really great positive for us.
Okay, and to add to that right away, this is something that we're moving forward with. What if I'm not very versed in technology? What if I really don't have the option to either travel, or I don't know how any of this works? I do know how to use a telephone and call someone. So is that another option with 211? Is that something you'd want to, I see Dr. Heidi, you're shaking your head up and down. Yes, on that. I'll let you kind of take away on that.
Yeah, so just to echo what everyone else has said, that, the telehealth option is a great option for those that either can't travel to an in-office visit or should, or have reasons that they cannot. And so that's the idea of having both the telephone visit, so that if patients, we can call them, we may not be able to see them, face to face, but we can still address a lot of issues over the phone and then be able to triage them and get them to those appropriate areas. And it's not just that way within our primary care clinics, but throughout our health system as well, especially with the specialties, cardiology, pulmonary, all of those other specialties are all equipped through Monument Health to do both telephone and televideo visit telehealth. So we're really working to provide that access to keep patients as healthy as possible during this time.
Perfect. Okay, so in that case, whether or not you are versed in the internet isn't really a factor. You can call in.
That's
and
right.
do it through that. Okay, that's perfect then. So that covers a lot of those bases for folks. Cassie, I wanted to kind of direct things your way. We have a question about, mental health, because it's something that always seems to take the kind of the back seat when this kind of stuff is prominent. So what are the resources available? Are there resources available through the state per se, where, man, I'm really struggling with mental health. I don't have COVID-19, but I'm stuck at home. I'm isolated. I'm not really sure, what resources to contact. Is there a way, or is there kind of a directory for me to go through you guys, or is there someone else I should contact?
So within the South Dakota Department of Health, we work closely with the Department of Social Services and the Department of Human Services. And when I was speaking earlier about the teams that we have in place to focus on certain areas with the COVID response, one of those is for special populations. So that could be individuals who might be suffering from mental illness. It could include our homeless population, as well as individuals that struggle with substance use. And so we do have a team that's focused on that and have worked on developing some resources that people can utilize. But I think kind of aligning with what all of our providers here today are talking about is there are so many resources available that if you are struggling with mental illness, please utilize your resources. Please talk to your healthcare provider. There are resources through telehealth that really can help serve our people. And I think we just need to continue to lean on that and ensure that people know that there's resources out there and available to them.
And a little birdie told me through the message that 605 Strong. Can you talk a little bit about that? Oh,
I can jump in. It's a new partnership with the state, and I can't remember which Department of Health or Social Science or Services, one of them. Anyway, with 211, they've done a new partnership to help provide some of that ongoing support for individuals who have been impacted by COVID. So it's called 605 Strong. You can Google it or go to 211 and then they'll get you there. But it's a great brand new resource from our state, again, to help provide some of that additional support for individuals.
That's really good. Okay. I did not know about that resource.
Yeah, it's brand new. I think it just launched last week, maybe. Wow. And 211 also has a great list of all of the mental health resources that are available in the Black Hills.
Thank you, Jamie, for bringing that up. I really appreciate that. And yes, please use that as a resource. We're coming out continually with more tools and resources available for people, and really look forward to gathering some support and some additional people utilizing those services.
Perfect. That is something I literally had to write it down. It's like, okay, that's something I learned already. I'm part of this panel. Goodness gracious. Okay, so we still have some really good questions being asked. Dr. Heidi, I'll let you see if we can point this in the right direction. Missy wants to know, will rally goers be able to get tested at Monument Health? So you're out of state, you're coming in, or maybe you're listening now, you're just happen to be in the neighborhood, but you usually don't come here often, and this is like your summer vacation, but you start developing symptoms. Can they get tested at Monument Health?
Yes, absolutely. They can get tested through any of our, by calling that triage line, that 755-1350, or if they're, in Sturgis, they can chat with the local providers there as well. But that is an option to call the triage line to see if they have the symptoms that require testing or if they've had exposures, and to give them some counseling and guidance about, whether they need to be tested or next steps. So I would definitely encourage that route for folks, and that can be anybody. They don't have to be patients within, our health system or people who even live here in the area.
And to piggyback on that, okay, so that's good. So if you do have symptoms and you're at the rally, you can get tested through the right process. And Ginny wants to know, and you may or may not know the answer, if rally goers do get tested at Monument Health and they test positive, are they reported through South Dakota, or are they reported as, maybe they're from Mississippi? And so does that number go to Mississippi and we don't actually see that number? Or I guess, how would that work in that case? Do we actually get data on that? Are we able to see that data?
Yeah, so my understanding is that through our Department of Health, all patients all people who get tested for COVID-19, especially with those positives, are reported through the South Dakota Department of Public Health. And then they use their contact tracers then to decide through the Department of Health, whether those contacts may have occurred and such. And just piggybacking on our discussion about information, there's also a website for anyone in reference to the rally goers or anyone who has questions about testing or other things. Monument Health/COVID facts is also an area where we report the total number of tests that Monument Health does and the numbers that we've seen to the state.
Okay, perfect. So that will answer. That was a question from Jenny, by the way, and it's a good question. She asked, if we get 150 positive tests, one day from rally goers or whatnot, it's like maybe that's not necessarily South Dakota. Maybe it's that's rally goers per se. And what is she adds that what is usually the turnaround for test results in South Dakota or maybe West River, or do we know that number generally?
Yeah, so it kind of depends upon the location. Like, for instance, we've got several types of testing analyzers within the hospital system and within Monument Health. So particularly for our hospitalized patients, we like that turnaround time, if at all possible, to be within 48 to 72 hours. Depending on some of the other testing, like through some of the triage locations, the testing time may take up to anywhere between 3 to 5 days. Sometimes a little longer, depending on shortage of supplies. That's one thing that we have seen with the surge in the southern states, is that occasionally there are some shortages with testing supplies, and we really try to provide that best turnaround, but sometimes we do have those barriers with just trying to get more supplies in, so we can keep running things as fast as we can for folks.
Okay, thank you. I know that was a hard-hitting question, but that's good to know. So in case maybe you have a slower turnaround, just maybe just hang on a little bit. It'll be coming your way. Just right. Depends on what's going on out there. I'll send this question to Mr. Tim. As far as, you may not have these numbers or not. This is from Miss Erica. She wants to know, have you seen increased requests for health services for children lately, or is there kind of a pediatric side of things as far as community health is concerned that people are having trouble with, or are kids able to get their checkups and whatnot relatively okay?
Yeah, they can, though. What we have seen is we've seen a drop, and really we've seen this across the state in terms of a drop in our immunization rates, and that fewer people are following through to get their immunizations. And so, and I think that's because people are concerned about, they're holding their kids back and they're not bringing them into the clinic. There are probably some that are, wondering in terms of whether they're going to have to get their immunizations, in terms of whether school starts or not, come the fall. And so, yeah, we think it's a real press that we'd like to encourage people to make sure your kids are getting immunized. If they're due for their immunizations, yes, you want to follow through with those to get those scheduled, because we are seeing that drop. And obviously, that's not something we like to see as a primary care provider.
I have put it as a bullet point, Tim's call to action to get your kids immunized. And we talked about earlier, yeah, we got thumbs up on.
That's right.
And we were talking about earlier, I forget who asked the question, but they said, should I be going to regular doctor visits? Yes, you should be going to your regular doctor visits. You should be getting immunized. You need to get immunized. You know, these things need to continue. Now, if you have symptoms, you know, make sure you're calling, you're making the necessary preparations if you have symptoms of COVID-19, but otherwise make those appointments. Get, you know, if you can, get your teeth checked, go to the dentist, talk to your dentist, at least through through telehealth. That's important. I saw a chat come up. Let's see, who do we have? We had, let's see, from someone on our page. At what point do we think about closing and isolating business? Okay, this is from Andrea. After someone has a fever, while another staff is being tested without known contact after a positive diagnosis with known contact. So for instance, someone, you're waiting on test results and it's been, 3 or 4 days, finally they get the test result back and you find out that they were positive, but they were in the work and, should they isolate while they wait for the test result? Is that kind of the procedure that we'd want to follow? And I'll send that to Cassie. That may be another Dr. Heidi question, but I'll send that to Cassie as far as, do we know what the protocol is on that?
Yeah, so if someone is experiencing symptoms, the recommendation would be that they do isolate at least until the point of time and when they receive that result back. For individuals who are in a workplace, we would obviously recommend that they would not be working during that time either. It could very well be that they're being tested and they may be positive for something else. We are obviously seeing some symptoms that align with a lot of other different illnesses as well. And I can let Dr. Heidi talk a little bit more about some of that aspect of it. But yes, in that type of situation, we certainly would want someone to isolate until that test result comes back.
And to tag to that, Jamie had a good question. Is isolation the same as quarantining?
I can take that if you'd like.
Yes.
Yes. So they are somewhat used interchangeably. However, when you're speaking of isolation, isolation is in reference to that positive person and the need to isolate. When you're talking about self-quarantine, that's an individual who was a close contact to a positive case. The days for each of those are different as well. So a positive person needs to isolate for at least 10 days. They need to have a period of time where they're at least fever-free for 72 hours. They need to have improvement in respiratory symptoms, and they eventually can then be released from isolation. But we need to see improvement in all of those areas before we would allow that. For individuals who might be asymptomatic, we also do recommend 10 days of isolation, but because they're not experiencing symptoms, they would isolate for 10 days from the date that they were tested.
Okay, that's a big difference. And that could be several days worth of a difference. Yes. So that's important. That's an important distinction. I'm writing that down.
And then also in regards to quarantine, that's a 14-day period of quarantine. So if someone was in contact with a positive person and they meet the criteria for a close contact, which is within 6 foot for 15 minutes or longer, we would recommend that they quarantine for 14 days from the date that they were last exposed. And during that quarantine period, if they begin to develop symptoms, we would then contact them and then discuss their symptoms and determine whether or not they meet the criteria to get tested. And ultimately that would be up to the provider and working with their provider on that. And that's when we would recommend kind of that referral to provider and determining whether or not they should be seen.
Perfect. Okay, so in that case, make sure you know the difference between the two, because you may be recommended to do one or the other. And it's different situations. So that is important. What I wanted to do was I wanted to give people kind of some last minute thoughts on this, kind of their 99 thesis on the issue and what we're going to be doing moving forward and what the hope is, some things that we're working on as we approach a very talked about school semester, what that's even going to look like. So Dr. Heidi, I'll let you start things off with any thoughts on that.
Yeah, fortunately here in South Dakota, we've got the benefit of space. We've been doing a pretty good job within our state and within our communities about keeping those numbers down. The biggest thing to continue to do that is, to continue to practice social distancing. And when you can't safely keep 6 feet away from another person, we really continue to encourage masking, because this is a respiratory virus. And we do have some, issues that people have heard about on the news and other places about people who may have symptoms, may be spreading the virus and have no symptoms at all. And I just want to mention that for those folks that do, unfortunately, end up, developing the virus and having a positive test, not everyone requires hospitalization. And so one of the other programs that we offer is a program through Monument Health called COVID Care Companion. And so for anyone that develops a positive test, our clinicians follow up with that patient. And then, sometimes if people are hospitalized, they can be discharged home a little earlier, and they're given a pulse oximeter and some guidance on monitoring symptoms at home, and a contact number of the person to call if they start to have any problems, so that we can try to keep people home as much as possible and to be able to self-isolate in the comfort of their own home, but to monitor them. So I think that's a really nice option for folks that are really concerned about just being hospitalized with this virus. And not everybody, obviously the vast majority of people do recover to a certain degree pretty quickly. And so there are options to be home and to be in your comfortable environment, but still be monitoring and keeping in touch with someone that can help if needed.
And this is not to put you on the spot whatsoever, but to say masks do work, and that is an option. Yeah. Okay. So said, masks work. So, okay. In that case, we'll send things over here to, actually, we have a question. Real quick. And I think I'm going to ask this for Cassie. If someone is a close contact and gets tested and is negative, are they released from quarantine at that point?
They would still remain in quarantine. If they test negative, that doesn't necessarily mean that they may not test positive 2 days later. So there's a period of time where someone might begin to show symptoms. And so we would still recommend that they stay in that period of quarantine for at least that 14-day period. And I do also want to share that part of our process, once we identify a close contact, is that we enroll those individuals in what's called text illness monitoring. So every day they'll receive a text from us that asks them if they're having symptoms or if they've developed symptoms. If they identify that they have developed symptoms, that's when we call them and talk through that with them and possibly recommend getting tested. But if they become symptomatic, then we start talking about isolation, which is again, that period of 10 days at least since they started developing symptoms, fever-free for 3 days, and also improvement in respiratory symptoms if they're having those symptoms. So it can be a little bit confusing to decipher, but we really want to serve as a resource and walk through those steps with people. So if there are ever questions, please don't hesitate to reach out.
Perfect. And on that note, since we already have you, I'll let you kind of put any last minute tabs on kind of what we've talked about today and kind of what the game plan is moving forward for us.
Yeah, so again, we have a lot of resources on our South Dakota Department of Health website. That's covid.sd.gov. And you can actually click on public health information. And that's where a lot of the resources that I'm talking about today are located. It's a lot of resources, but we also have our call-in number, which is 1-800-997-2880. And that really is a hotline where we get a lot of questions, and those individuals are able to point those callers in the right direction. I also want to just make sure, like we've been saying today, please take care of yourselves. Make sure that you're going into your provider visits, get your kids immunized. School is starting up. So those kindergarten and 6th grade shots didn't go away. They are still necessary, because the last thing that we want in the midst of COVID is another respiratory outbreak of a preventable disease that we have vaccines to prevent against. So take care of yourselves, everyone stay healthy. South Dakota is doing a really good job in the response, and we're thankful for everyone that's been working with us.
Cassie's got the call to action there. Take care of yourself. Listen to Cassie. She knows what she's talking about. Tim, I'll let you go with any last thoughts that you may have as far as community response and what we're looking forward to moving forward here.
It's really tough to figure out exactly what the future is going to look like. But I mean, I think a lot of the changes that we've put in place are probably going to be with us for a while. And so, yeah, I think that everybody should be, kind of trying to proceed safely in terms of, wear your masks when you're going out and take those, basic, simple steps that you can do for social distancing to prevent that spread and to take advantage of the fact that we do live in an area of relatively little spread. And then, like Cassie said, follow through, get your, stay on your medications, get your exercise, eat right, and follow up and get your immunizations and follow, see the doc. And so, make an appointment. Come in and see us. That's what we're here for.
Some really basic things can really help in that case. Having an apple a day, staying a little bit healthy. Okay, I like that. Okay, let's put things over to Ricky with any last minute thoughts on this.
Thank you. So I think that one of the things that I'm so proud of is that we have built some of these really strong collective relationships throughout this entire process. And I really hope that moving forward, we can help maintain all of those relationships within our community. The Oyate Health Center has become a partner and developed these partnerships, which I don't know have ever really truly existed before all of the COVID operations, but we're very proud of where we stand within our community at this point in time. Moving forward, of course, we want to continue practicing all the CDC guidelines, maintain social distancing, wearing a facial covering, mask and such, good hand hygiene. And that's about it. Thank you.
Ricky, I think you have to sing happy birthday. And the time that you sing happy birthday?
Twice.
Twice. Okay. Make sure you sing happy birthday twice as you're washing your hands. That's actually how long you were supposed to be washing your hands. Jamie, I'm going to let you kind of close things out here with any last minute thoughts. Moving forward here, what are we looking at? What are some of the partnerships that you've seen come together? Ricky was just talking about how she's seen a lot of different conglomerates come together with this, and it's making things work a lot better. What are you saying?
Yeah, to echo that, we've got such strong partners in our community who have all come together to say, what can we all do to help meet the needs, whatever those needs are. And so we're just really proud. I think that that's going to continue. Some of the processes that have been streamlined for efficiency during the pandemic are going to continue and help us all be more impactful with all of our work in the future. So those are some positive pieces. I do want to mention, again, we've talked 211 as that hub if you need other resources too. They are also the hub for mask making efforts in our West River area. And so there are a lot of different groups that are working on volunteer mask making, that those masks are then donated to either healthcare workers, long-term care employees and workers, child care centers. As we think if school does come back in some form or fashion, and if kids are required to wear masks, there's going to need to be a lot of masks for kids. So I'd encourage you, if you have any sewing skills, to maybe go on there, check it out. Western Dakota Tech is leading a strong mask making effort. Their goal is to make 60,000 masks, and they're about 2/3 of the way there, I think, but there's other efforts elsewhere in the hills. MakeSpace is doing it up in Spearfish. So 211 is the hub that has that information on where you can help with that. So, and also, giving back is really important right now too. Volunteer opportunities are on 211. Everybody is doing all of the precautions needed, but we still need help with that types of thing, like delivering food with Meals on Wheels or those sorts of things. So yeah, just know there's a lot of cool stuff happening, but there's a lot of ways you can help and give back. And if you want to give monetarily, we of course have our COVID fund that you can go to our website to learn more about, as well as see the grants we've done, but others as well. And anybody who needs funding, any organizations can always apply for our grant as well.
There are so many great points in there. The fact that there's a lot of unnamed smaller organizations that are making big impacts folks that may not be on this panel, but are making a big impact on the medical community. And if you're, maybe one of the resources you're looking for wasn't necessarily in this discussion, but it's probably available in the Black Hills, going to that 211 site and making sure that you follow the right channels there and getting to where you need to go. It's just super important. And for those that are looking to help, it's like, man, I really wish there was something I can do. Same place. You can find out. It's like, well, I'm not very good at making masks. It's like, well, monetary donations are great. In fact, it's one of the best things you can do, because that way those nonprofits can purchase what they need, where they need it, and send it where it needs to go electronically, all that good jazz, the quickest. It's one of the best ways to get that done. I want to thank everyone in this panel for taking their time out of their Friday in the AC, granted, since it's very hot outside, taking their time to talk about this. This is incredibly important. I think people are going to be referencing this conversation later on as we get things going. In August, Rally Week is coming up, so there should be a lot of different questions out there, and we'll be able to reference this and come back to this conversation that you guys have taken the time to put together. So thank you, everyone, for joining. We'll go ahead and go on about our day today, but the discussion has not ended. It's just the start. And make sure to, if you guys have questions, to check out in the comment section. We're going to have links to the different organizations that were here, and on News Center 1, NC1.tv, we'll have links to all of these places as well. Thanks everyone for joining. Make sure to join us as we move forward through this. We'll have more information. Clear. I think that's what I heard. Did I talk too soon? Did I ruin it?
Nope, we're clear.
Yes. I heard Billy say
Oh.
clear. I'm like, is that for me? Is that for us? Cool. That was
Amazing.
great.
Yeah.
Thank you so much.
Yeah, thank you so much for allowing us the opportunity. And it's always really great to connect with some people, and I may reach out to you guys now for some resources. So great work, everyone. I was very
Thank
pleased
you.
with that.
Yes.
Thank you very much.
Thanks for
Yeah.
hosting us, Brent.
Yes.
Oh, this is a no-brainer. This is awesome. I talk a lot, so it's nice to have other people that have things important to say things. So it's quite nice. No, but I learned things today that I did not realize. Period. End of story. So I know people are gonna. We had a good 60 to 80 people watching at any given point on the Facebook Live. Yeah. So there's a lot of folks going in and out and posting questions, and one of the more popular ones we've done. So we'll be able to reference this. And in fact, what I'm going to do is I'm going to sit down with my news director after this, Mr. Tim. Cassie, what you have done, you won't believe it. The call to immunization, making sure that you're getting into your doctor visits. That's a story.
Was it too obvious?
No.
that?
Was it too obvious? Go to the doctor. If your tooth falls out, go to the dentist. Like that's a story. People aren't.
We're pretty
going.
nice.
Yeah, it's good. It's super important. So I think that's a great point. We may Tim, Cassie, we may be calling you up, Dr. Heidi. We might be calling you up, asking for official references on it. But like, should you go to the doctor? Yes, you should. So That was wonderful information. But yeah, once again, thank you all for your time. We'll let you go about the rest of your day and hopefully you have a wonderful weekend. I'm going to check the temperature. I'm sure it's already in the 90s, perhaps, outside, and we'll go from there.
All right.
Sorry,
Have a great
Ricky,
day.
before everyone goes, Ricky, is IHS, the dental offices there, are you guys operating those or are they closed currently?
So
I know there's two entities and I'm sorry, I'm
Yeah,
just used to
they're both open. So we operate the Oyate Health Center one, obviously, and we are open for everything.
okay.
Yeah.
Just for Brant's information on how he could perhaps tie in kind of the Native American healthcare system side of things as well, because I feel like it's an underserved topic.
Yeah.
I'm Lauren Brannick, by the way. I didn't actually get to introduce myself when we first on the call. I'm the digital sales manager. Jamie has my contact information just for everybody. If there's something you guys need and you utilize us as a service or get some information out,